Hi everyone, I'm Shivani Kalhan, a health coach and a diabetes expert at Besugarfit. So let's discuss, why people start smoking. Many studies and research conducted in this field indicate the direct relation between smoking and severe health problems. Despite knowing this fact, smokers are unable to kick off this habit of smoking. There are many triggers that result in people starting to smoke. Some of the major reasons behind people starting to smoke is deriving pleasure, stress relief, and in social situations. Once they start using nicotine and tobacco, they get addicted, and this means that they cannot live without nicotine. With time, the body and the brain gets accustomed to getting a nicotine fix. And despite making a decision to quit smoking, smokers are unable to kick away this habit. Chain smokers especially feel a buzz of energy and pleasure as soon as they start smoking. The body of chain smokers build up a high tolerance of nicotine, and as soon as they embark on the journey to quit smoking, their bodies react aggressively. They experience a variety of withdrawal symptoms that makes quitting an uphill task for them. They may feel extremely sad, difficulty in sleeping, trouble thinking clearly, inability to focus on things, slow heart rate, feeling jumpy or restless, and even more. Some symptoms are manageable, but some are extremely disconcerting, making it difficult to stay on track and meet the goal of quitting smoke. Quit smoking timeline can help in this regard. Smoking is responsible for causing many conditions. Smoking is the major reason responsible for lung cancer. Chain smokers who smoke 15 to 30 cigarettes in a day are more prone to lung cancer than the non-smokers. Even a few cigarettes a day can damage the lung, resulting in this fatal disease over the years. So just quit smoking. Chain smokers suffering from lung cancer experience a lot of side effects. Some of the major side effects are persistent cough, shortness of breath, unexplained weight loss, chest pain, coughing of blood, loss of appetite, feeling weak or tired, and more. Another condition caused due to smoking is heart disease. Smoking cigarettes can result in heart problems that are manifested in high blood pressure, high levels of cholesterol, obesity, and peripheral arterial diseases. The benefits of quitting smoking are to enjoy a healthy existence and a strong heart with no complications. Chain smokers suffering from smoking-induced heart diseases suffer from several side effects. Some of the major issues are thickening of the arterial walls, increased heart rate, irregular heart rhythm, and increased chances of stroke. Thus, stop smoking cigarettes and enjoy the benefits of quitting smoking by having a stronger heart. So I'll tell you 10 easy ways to quit smoking. First is the nicotine replacement therapy. The first and the easiest way to quit smoking is to go for a nicotine replacement therapy. The doctor may prescribe several options that includes nicotine gums, patches, nicotine inhalers, or spray. Stop smoking medications. These are short-acting therapies in the form of patches and gums that can work well with long-term therapies like non-nicotine medications. The doctor can suggest the best therapy that works for a chain smoker. Second, delay tobacco craving. It is another one of the most effective way to quit smoking. As soon as the chain smoker feels the urge to smoke, he must distract his mind and delay tobacco craving as much as possible. Try taking one step at a time. Delay smoking by 10 minutes and gradually increase this time. Soon the craving to smoke a cigarette will be under control. Use smoke-free zones in public area. Third, avoid triggers. The third way that works well when planning to quit smoking is to avoid all those triggers that result in small smoking episodes. Try to identify situations when the urge to smoke was the highest. As soon as you are faced with the same situation again, move away from that situation. It is particularly important for people who are already on the path to recovery. This will avoid the smoking relapse scenario. Fourth, indulge in physical activities. Whenever the urge to smoke tobacco is very strong, look for some simple physical activity that keeps you occupied and engaged. Look for simple ways to quit smoking. Physical activities like skipping rope, running up and down the stairs, needlework, praying, or anything that keeps you busy and allows you to blow your steam. As soon as the movement passes, you will start feeling normal and better. Fifth, do not get tempted. Many times, smokers think that they will just have one cigarette and will not go for the another in any case. The fact is that once he smokes one cigarette, the urge of smoking more gets stronger, and this results in chain smoking. There is never only one, and this is just one way of fooling ourselves. Do not allow yourself to succumb to this temptation, as one always leads to the other. Sixth, stay away from the other smokers. If you are already on the verge of quitting smoking, it is imperative for you to stay away from other smokers. Passive smoking has the same harmful effect on the body as direct smoking. Staying away from other smokers will keep you safe from the negative impact of passive smoking. It will also keep you resolved to quit smoking stronger than ever. 7. Set a timeline. Set small achievable goals for giving up on smoking. Set a stop smoking timeline and stay right on the track. Avoid long-term goals as it is tough to achieve, but set small goals as achieving a couple of them will fill you with confidence and your chance of achieving the goal decided by you will be higher. Keep reminding yourself about benefits of stopping smoking. 8 is practice relaxation techniques. Another one of the several tips to quit smoking is to practice relaxation techniques. Instead of using smoking as the means to relieve your stress, resist it forcefully. Try to calm yourself down by relaxation techniques. It impacts on reducing your stress levels, which are muscle relaxation, deep breathing exercises, massage, visualization, or listening to soft and calming music. 9th is to get support. If you find yourself unable to manage to stay away from tobacco effects, call it in reinforcements. There is no threat of support group that helps smokers to shun this habit and helps in effort of curbing tobacco cravings. These support groups can be contacted for help through phone calls, periodic meetings, and counseling helps. Call on the helpline to take support from the groups. 10 is to remind yourself of the benefits. The last but not the least, it's the most effective way of staying away from tobacco effects is to continue to remind yourself about the benefits of quitting to smoke. Begin with no smoking day and increase the number gradually. This is the best way to stop smoking. Keep reminding yourself that smoking is bad, and gradually you will find yourself coming out of this habit and reclaiming your good health. Thank you.